Stroke, causes, prevention, and natural recovery strategies. Understanding stroke, the basics. A stroke occurs when blood flow to the brain is interrupted, either by a blood clot, ischemic stroke, or by a ruptured blood vessel, hemorrhagic stroke. Brain cells in the affected area begin dying within minutes, leading to potential long-term disability or death. While high blood pressure, smoking, and a diet high in processed foods increase stroke risk, emerging research reveals that nutrient deficiencies, chronic inflammation, and metabolic dysfunction also play significant roles. Key factors that influence stroke risk: chronic inflammation and oxidative stress. Excess free radicals and prolonged inflammation contribute to arterial damage and impaired blood flow. Nutrient deficiencies, low levels of magnesium, vitamin K2, omega-3 fatty acids, and antioxidants weaken vascular integrity. High homocysteine levels, elevated homocysteine, often caused by low B vitamin intake, increases stroke risk. Poor blood sugar regulation. Uncontrolled blood sugar and insulin resistance contribute to vascular damage. Nutrients that protect against stroke. Scientific studies highlight the importance of specific nutrients in stroke prevention and recovery. 1. Magnesium, the stroke defender. Studies show that magnesium helps regulate blood pressure, reduce arterial stiffness, and prevent excessive clot formation. Magnesium deficiency is linked to a higher risk of stroke, as it contributes to poor circulation and inflammatory damage. Magnesium improves cerebral blood flow, reducing the likelihood of stroke-related complications. Best sources and dosage: food sources, pumpkin seeds, spinach, almonds, and avocados. Supplements: magnesium L-threonate or magnesium malate at 400 to 600 milligrams per day. 2. Omega-3 fatty acids, enhancing blood flow and brain health. Omega-3s reduce inflammation and prevent excessive clotting, protecting against ischemic strokes. DHA, a form of omega-3, supports neuroplasticity, helping the brain recover after stroke. Research suggests that higher omega-3 intake is associated with lower stroke mortality rates. Best sources and dosage: food sources, wild-caught fish, salmon, sardines, walnuts, flax seeds. Supplements: DHA, EPA at 2,000 milligrams per day for stroke prevention. 3. Vitamin K2, preventing arterial calcification. Essential for directing calcium to bones and away from arteries, reducing the risk of clot formation. Deficiency in K2 is linked to atherosclerosis and vascular stiffness, increasing stroke risk. Best sources and dosage: food sources, natto, fermented soy, egg yolks, grass-fed dairy. Supplements: MK7 form of K2 at 90 to 180 micrograms per day. 4. Curcumin and flavonoids, natural anti-inflammatory agents. Curcumin, from turmeric, reduces oxidative stress and inflammation, both major contributors to stroke damage. Flavonoids like quercetin, luteolin, and hesperidin protect against post-stroke brain damage. Best sources and dosage: food sources, turmeric with black pepper for better absorption, apples, onions, citrus fruits. Supplements: curcumin 500 to 1,000 milligrams per day with black pepper extract. 5 B vitamins, lowering homocysteine levels. High homocysteine levels increase stroke risk, but B6, B12, and folate help regulate it. B vitamins support neuroprotection and brain recovery post-stroke. Best sources and dosage: food sources, leafy greens, eggs, beef liver. Supplements: B complex with methylfolate and methylcobalamin. Natural strategies for stroke recovery. Beyond emergency medical treatments, natural interventions can significantly improve stroke recovery by reducing brain inflammation and supporting neurogenesis. 1. Hydration and electrolyte balance. Dehydration can worsen stroke severity, while proper hydration supports circulation. Adding magnesium and trace minerals to water enhances vascular health. 2. Ginkgo biloba and vinpocetine for blood flow. Ginkgo biloba improves microcirculation in the brain, aiding stroke recovery. Vinpocetine has been shown to enhance oxygen delivery to brain cells. 3. Avoiding dietary excitotoxins. Processed foods contain hidden excitotoxins, MSG, aspartame, hydrolyzed proteins, which worsen stroke damage. A clean, whole food diet reduces excitotoxic stress on brain cells. 4. Reducing post-stroke inflammation. Anti-inflammatory compounds such as resveratrol, green tea extract, and DHA help reduce secondary damage in stroke patients. Regular movement therapy and brain stimulation support neuroplasticity. Final thoughts: taking control of stroke prevention. Stroke is not an inevitable part of aging. By optimizing diet, supplementing with neuroprotective nutrients, and addressing inflammation, we can significantly reduce the risk of stroke and improve recovery outcomes. Understanding the interplay of brain health, vascular function, and nutrition empowers us to take proactive steps toward longevity and vitality. As always, consult with a qualified healthcare provider before making any dietary or supplement changes. Your brain deserves the best care. Start nourishing it today. Podcast disclaimer. This podcast is for informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional before making any decisions regarding your health, supplements, or treatments. The information shared is based on available scientific research and discussions in the medical and scientific community. We encourage listeners to explore multiple sources and make informed choices that align with their well-being.